In my view, human rights are what every person should have access to in order to be safe and secure and healthy. And that means every person has access to them equally. So that's what my view of human rights are. That depends on who you ask. For myself and for the ACLU and for other organizations that care about the health and well-being and safety of incarcerated people, we don't believe that incarcerated people have different human rights than people who are not incarcerated. We believe that incarcerated people are entitled to the exact same rights as people who are not incarcerated. And frankly, believe that incarcerating people in the first place is an enormous violation of human rights, especially if they are not an immediate violent threat to the community, threat to the physical safety of the community. So, in short answer, the state and many other people involved in the criminal legal system act as though incarcerated people do not deserve and do not have the same human rights as everybody else. We do not agree with that. The ACLU does not agree with that. The Innocence Project doesn't agree with that. Many other organizations and people do not agree with that. Incarcerated people should always have the same access to human rights as the rest of the population. The living conditions in prisons are abhorrent. You're putting people in locked cages or locked cells, oftentimes without access to daylight, fresh air, or sunlight. The food in prisons is abominable. The nutrition value is almost non-existent. People do not get enough food, and the food that they can buy for themselves is mostly junk food that is not necessarily good for them. Access to fresh vegetables, access to fruit, access to really any food that is not processed or comes out of a can or a bag is almost unheard of, and it's really, really hard to maintain nutrition when you're in prison. There is an enormous amount of physical abuse in prison, both between inmates and between corrections officers and the people who they're supposed to be taking care of and protecting. That goes for public prisons, and the private prison industry is actually, the private prison industry is actually much worse. What else? Access to outdoor space is available, but not enough. People with disabilities who live in carceral settings are suffering at a great amount because they can't get access to the things they need in order to take care of themselves, but also because in many carceral settings, for example, cells aren't even big enough to fit a wheelchair comfortably in. So it's hard to turn around. It's hard to even move around as if you're in a normal space because most prisons, especially older ones like MSP, often aren't equipped with enough cells that are actually accommodating to wheelchairs and other assistive devices. Let's see, you have no access to your friends and family except on visiting occasions, and right now those are banned because of COVID. Human contact is essentially slim to none. Your religious rights are violated because, for example, in the case of Native American people, many things that they need to practice religion are banned in carceral settings and are not accessible to them. And to talk about, what we traditionally think of as like the human rights issues. I mean, when you think about LGBTQ people, transgender prisoners in carceral settings are treated terribly. Many are put in facilities of the gender that they don't identify with, and it puts them in grave danger. And God, at a very basic level, healthcare in a carceral setting is terrible. If you can get healthcare at all, it's usually below grade. The people who are meant to give you healthcare, including medical doctors, mental health experts, et cetera, are often really hard to keep on staff, and there often aren't enough to supply the demand for medical care in hospitals. So, I mean, anything you can think of: medical care, food, human contact, space, sunlight, adequate hygiene. All of these things, none of them are up to snuff in a carceral setting, and are in fact way, way below the standards that many of us would consider inhumane. Well, I think that the biggest, you know, I've talked to so many reporters about the COVID-19 pandemic in carceral settings, and we talk ad nauseum about how Cascade County Jail and regional prison is denying masks to people incarcerated there because they say it's a safety issue, and now they have an outbreak. We talk about how prisons and jails don't have adequate access to hygiene, and it's going to spread the risk of COVID even more quickly. We talk about how you can't socially distance in carceral settings, especially when you are sharing a cell with somebody. We talk about how the only way to stop the spread of COVID in these spaces is to reduce the number of people in those spaces. So we talk about all this stuff. We say these are the recommendations from public health experts. These are the basic things that people need access to in order to not contract and die from the COVID-19 pandemic. And it's masks, adequate hygiene, and social distancing. Those are the things. And none of those things are possible in carceral settings. And I think the lack of human rights that has come to the forefront during COVID is that people do not, our governments and the people running our carceral facilities do not see incarcerated people as worthy of care in ways that they think everybody else is worthy of that care. And the only difference is that those people are in a carceral setting. And just the general lack, and this is what I've talked to so many reporters about, and for the life of me, I cannot get anybody to write a story about it because I understand that it's complicated, but there's just a really disheartening, disturbing, and just soul-crushing lack of empathy, of human empathy for people who are incarcerated. And these are people's family members. These are people's siblings and dads and moms and uncles and brothers and sisters and nephews and nieces. I mean, people care about folks in these carceral settings, and they don't want them to die. And the response to that from the state and at the county level is, well, they're incarcerated, so we're going to just treat them substandardly than we would, kids in schools, elderly people in nursing home facilities, all these other places that are taking all these precautions. None of that is happening in the carceral system, and we've told them over and over and over again, here's what you have to do, and it just falls on deaf ears. So I think that the greatest tragedy that has come to the forefront that we already knew about, but which has now been more than highlighted by the COVID-19 pandemic, is that the state has little to no human empathy for people who are incarcerated. And that is the beginning and end of the poor treatment that people get when they're incarcerated. I hope so. I hope so. The outbreaks we have in Montana right now in our jails and prisons are terrifying. I mean, MSP has an enormous outbreak. The women's prison has an enormous outbreak. The Great Falls Regional Prison had an outbreak. Shelby has a terrible outbreak, which is the Crossroads Correctional. Every major prison in Montana. I haven't heard anything about Dawson County Regional Prison, or Dawson, I think it's Dawson County Regional Prison. I haven't heard anything about that one. But MSP, the women's prison, the private prison in Shelby, and the regional prison in Great Falls have all had these terrible outbreaks. And no one did anything to prevent it, did anything adequate to prevent it. And heeded warnings of public health officials in every other sector of the world except carceral settings. And now we have hundreds of people, both people who are incarcerated and correctional officers who also don't deserve to contract COVID, suffering and getting sick and dying. There have now been deaths in the Montana State prison system because of COVID. And I hope we learn a lesson from that. But, there's been horror story after horror story of what happens to people in prison. And it hasn't changed how we operate. And I don't know what will change how we operate, but I hope that if something can come out of COVID, it is that we start thinking about the disproportionate amount of suffering that the state levies against people who have been convicted of a crime. It is completely inhumane, and should be called out. They need to get involved in a bunch of ways. So first of all, I think first and foremost, and this is just my opinion, but I think first and foremost, we all have to start talking to each other about the rights and humanness of incarcerated people, just like we do any other marginalized and at-risk population. So talk to your friends, talk to your family, you know, read a book, read 13, read anything, and start having conversations in your community about why our current carceral system is not just bad for people who are incarcerated in it, but it's also bad for our communities. I mean, we've seen study after study that shows that COVID-19 spread in county jails and prisons leads to increased community spread and morbidity. It's not just happening, it's not just that it's impacting that facility, it spreads out into your community at a greater level when it's in your jail or in your prison. So we have to start talking to each other about what it means when we treat people the way we do in the carceral system and how it impacts our communities at large. How it tears families apart and how it prevents people from being able to go back to their communities and be productive and get a job and do all these things. It doesn't help to have a carceral system like we do. So we have to start talking to each other about that. We also have to start making sure that our elected officials know that we care about this issue. It's, you know, we have so much better luck, and I'm not saying this is a bad thing, but when you put a call out into the community to say, call your elected official on this really bad anti-trans bill, call your elected official about this very bad abortion bill. We want people to call, absolutely, but we need people to be just as reactive when we're talking about incarcerated people. And we also need to start, if you're listening to this, please start supporting organizations who prioritize this issue. The Montana Innocence Project prioritizes this issue. The ACLU of Montana prioritizes this issue. You know, there are any number of organizations in the state that are starting to think more about this and do more work on it. But we have to increase the capacity on the ground for organizing around these issues. So I'd suggest seeking out organizations in Montana, anywhere that you care about, that are working on the rights of incarcerated people and changing the criminal legal system and giving them your support.